Okay, hello everyone. It is 12:01, so we will get started. Thank you for joining us and welcome to today's webinar, which is the third of our paramedic series that will address the mental health among Canadian paramedics during infectious public health crises. My name is Corey Jameson and I am the Public Relations Intern at the Canadian Institute for Safety, Wellness and Performance, which is hosted at Conestoga College's School of Business. Frontline healthcare workers, such as paramedics, have risen to the challenges that COVID-19 has presented, playing a vital role in maintaining public health and safety in the face of the health crisis. Paramedics, however, are a high-risk group of workers for developing mental health injuries due to a unique set of stressors. Paramedic service organizations have expressed their concern that the COVID-19 pandemic will be an additional significant stressor for their frontline staff, further increasing the prevalence and severity of mental health injuries. This research project aims to rapidly mobilize solutions and expertise to develop a rapid guideline for the paramedic community to prevent and manage mental health injuries during and after the COVID-19 pandemic. Today's webinar will present the new evidence-informed guideline for paramedic service organizations to address operational stress injuries during infectious public health crises. Our speakers for today are Bronson Dew and Dr. Amin Yazdani. Bronson is a research scientist at the Canadian Institute for Safety, Wellness and Performance. He has expertise in developing organizational level guidelines and resources for the prevention and management of work disability and in integrating human factors and ergonomic principles into industry-specific design standards. He applies a systems approach for data collection, analysis, interpretation, and reporting to inform the development of workplace interventions. Dr. Amin Yazdani is the director of the Canadian Institute for Safety, Wellness and Performance at Conestoga College's School of Business. Dr. Yazdani is a member of the Canadian Standard Association, the CSA Group, Occupational Health and Safety Strategic Steering Committee, and is also a recipient of the 2018 Standards Council of Canada Young Leader Award. Dr. Yazdani uses a multidisciplinary strategy to develop innovative approaches to prevent workplace injuries and work disability at the organizational level. Dr. Yazdani has extensive experience in collaborating with small, medium, and large organizations to implement organizational-wide approaches to prevent workplace injuries and improve productivity and performance. In collaboration with industry stakeholders, Dr. Yazdani spearheaded the development of several Canadian standards for paramedics, including ergonomic design for ambulances and related equipment. He is also the chair of several standards development technical committees, including the development of fatigue risk management standard for first responders and work disability prevention management system standard for paramedics. The format for today's webinar will be a presentation from Bronson and Dr. Yazdani, and then there will be time for a Q&A session near the end. So if you have any questions during or after the presentation, please use the Q&A function of the Zoom platform to ask any questions, and we will get to them near the end. I will now hand it over to Dr. Yazdani to begin his presentation.
Okay, thanks, Corey. I'm very pleased to be here today and inform you that we'll be launching the new guideline for paramedic service organizations to address occupational stress injuries during infectious public health outbreaks. So I would like to welcome you on behalf of the CSWP and the Conestoga College, and appreciate our partners contribution to development of this guideline. This guideline provides an opportunity for paramedic service organizations across Canada to improve their practices in addressing the need of paramedics in response to public health crises such as COVID-19 pandemic. What we do today is that we'll begin with a brief introduction and provide a quick overview of research behind the guideline. And then we'll introduce the guideline, and my colleague Bronson Du will walk you through a guideline. The evidence-informed guideline is organized into 10 organizational elements, which provides a comprehensive response plan to address the mental health needs of paramedics during public health crises such as COVID-19 pandemic. For each of these 10 elements that we included in this guideline, we've provided a description of the element and the importance of these elements. We have some quick notes and tips for the implementation, and also a reflection checklist, which will be available within the next couple of weeks. At CISWP, we've been really focusing with our partners in spearheading several important initiatives to address the health and well-being of paramedics across Canada. But why we felt that this specific guideline is needed? Well, in the previous webinars hosted by CISWP, we talked about the high rates of operational stress injuries among paramedics. A previous research suggests that about 50% of Canadian paramedics is screened positive for at least one mental health disorders, and that there is a need to consider supports for a range of mental health conditions in addition to the traditional traumatic focus interventions. And the reason is that it's not only PTSD that is a concern. Depression and anxiety are actually more prevalent among this population. So we discussed in the previous webinars how paramedic work was inherently high stress with limited job autonomy, and how organizational and operational workplace stress might play an even larger role on the mental health of paramedics than exposure to, let's say, potentially psychologically traumatic events. And this has really been the aim of our research, to develop tools and guidelines such as this guideline to support the paramedic service organizations in addressing the OSI related stressors in the workplace. So our research really focused on what organization, the paramedic service organizations, can do as opposed to what an individual paramedic can do, or the type of clinical treatments that mental health professionals can do and should provide. So what we have been kind of trying to do is look into paramedic job and focus on what kind of tasks they perform. So paramedics provide these out of hospital emergency medical care, but they also do preventative calls as well, such as the community paramedicine. Right now, paramedics play a large role in providing vaccination in the community. So their role is much really beyond a kind of just providing the emergency medical care, and they are kind of part of a significant part of the community. So inherent to the work is tending to medical calls. Some can be exciting and manageable, while others can be frustrating and non-urgent, and potentially some psychologically traumatic to paramedics. So at long hours, at shift work, at being on call for a period of time, at this commuting and so on, and that kind of demonstrate that the paramedic work is a very complex task that is considered to be high stress with little job autonomy. And there are a lot of occupational stressors to the job, but the job can also be very fulfilling. Unfortunately, paramedics are a high-risk occupational group for a range of mental health problems, including both clinically and non-clinically diagnosable conditions that interfere with daily functioning. And I believe that there is some kind of confusion around some of the terminologies. But for this presentation, we refer to this range of mental health conditions using the broad term of operational stress injuries, or OSI. The OSI is inclusive of post-traumatic stress injuries and sometimes used interchangeably, a broad range of conditions, including diagnosable mental health disorders such as anxiety disorders, depressive disorders, PTSD, as well as the non-clinical conditions that may interfere with daily functioning, is again inclusive of the definition that we're focusing on today. So OSI is not diagnosable mental health disorders, but may be used to refer to one or more specific diagnosable mental health disorders, or to another mental health problem. And I just want to kind of mention this here, that these injuries can be caused by work-related and non-work-related exposures. So there is that important note that I needed to mention here. So what we have done is we've done a lot of research on the impact of public health crises on paramedics. So what COVID-19 has shown us is that in addition to stressors during regular operations, there are numerous stressors that comes along with responding under pandemic conditions. Our research, looking at scientific literature, which again, Bronson has done an amazing job on that, focused on paramedics and potential stressors during previous public health disease outbreaks. And that research revealed that, for instance, concerns over personal safety, concerns of safety and well-being of loved ones as a result of their work, adapting to changing job requirements, dealing with lack of knowledge and overwhelming amount of information, and last but not least, making ethical decisions have been the additional stressors that further complicates the work of paramedics and put additional stressors to paramedics, and that could result in additional risk of OSI. And again, as I said, this adds to that complexity of the issue, not only for paramedics, but also for paramedic service organizations of how to deal with these additional factors. So this brings up the question, what can we do to reduce the risk and impact of OSI? And we know that responding to potentially psychologically traumatic events and some of the stressors associated with infectious public health outbreaks are unavoidable. But there is also increasing evidence that tells us about organizational factors such as psychological safety climate, leadership styles, mental health training and awareness to be significantly and independently associated with OSI. So a recognition of modifiable occupational factors offer paramedic service organizations an opportunity to implement some strategies at organizational level to manage the risk of these injuries in the workplace. With that with that in mind, we conducted two studies that focuses on collecting data to inform the development of the guideline, and as to what organizations can do to prevent and manage OSI in the workplace. And we had amazing partners for this type of research that we did, and we were really excited that these research informed the guideline. The largest gained kind of out of this exercise that we did might be made by focusing on leadership training and support, improve organizational engagement, reduce stigma, improve sleep, and strengthen social support. But that's not only kind of things that could be done. Again, my colleague Bronson Du will kind of walk you through the research behind the guideline and introduce the guideline today, that you will see that these 10 organizational elements, which again, they are, many of you might be familiar with them, could potentially provide additional resources for paramedic service organizations to address OSI. So let me hand it over to my colleague Bronson Du to discuss the research behind the guideline and walk you through the guideline. Bronson, floor is yours.
Thanks for that introduction, Amit, Dr. Yazdani. Before we get into the guideline today, I first want to give a quick recap of the first two webinars that talked about the research and development of the guideline, just to give you a sense of where all the recommendations that you'll be seeing is going to be coming from. So let's click next slide. So far in the webinar series, I've shared and presented the results of 4 research projects that were used to inform the development of this guideline. There was an environmental scan of recommended practices and programs for addressing OSI, and an interview study to better understand key informants' perspectives on the existing and desired organizational-wide initiatives for reducing the risks and impacts of OSI. And these studies were done before the onset of the COVID-19 pandemic. Now, once the COVID-19 pandemic hit, we reviewed the scientific literature on the mental health of paramedics during infectious disease outbreaks and conducted more key informant interviews to gain some insight into the experiences of paramedics and their organizational leaders in responding to the pandemic. And so this combination of studies is so critical, because reading all the guidelines and research articles is great in itself, right? But the interviews with people on the front lines really gave us more context to help ensure that the guideline would be relevant and pragmatic for the Canadian paramedic service organizations. So I'll briefly go over some of the key findings of each of these studies. From both the environmental scan and the key informant interviews that were conducted prior to the pandemic, those studies were built around this disease prevention model for intervention. And we use this model to ensure that we considered supports for all states of mental health along this mental health continuum, from those who are at a mentally healthy state to those who are in a work debilitating mental state. And so in brief, this model has 3 levels of interventions. There is primary prevention, which is really for everyone, but it mainly focuses on interventions to help those who are in a mentally healthy state remain in a mentally healthy state and to minimize the risk of OSI. So those can be things like mental health training and health promotion and things like that. There's also early detection and intervention. Now, those are initiatives to identify and support individuals with early signs and symptoms of OSI. So things like peer support. And there's disability management, which is to support those with recovering, who are recovering from work debilitating OSI. And if or when the OSI becomes manageable, their work reintegration. So through the environmental scan, we built upon this model and identified recommended practices, programs for paramedic service organizations that they can implement at each level. And from the key informant interviews, we identified their desired organizational elements to address OSI at each level of the disease prevention model. So for primary prevention, having a psychologically safe and healthy work culture, consistent supervisor support, mental health training and awareness, opportunities for recovery and maintaining resiliency, those were really desired elements for primary prevention. Now, for early detection and intervention, desired elements were recognition of OSI and its stressors, and having a variety of support initiatives for occupational or operational stress injuries. And desired elements for disability management was having communication during medical leave and having meaningful work accommodations. So those were the key findings from the two studies that were conducted prior to the onset of the COVID-19 pandemic. Now, once the pandemic hit, we conducted a scoping review. So here we identified 27 peer-reviewed original articles that discussed in English occupational stressors or organizational level mitigation strategies that may impact the mental health of paramedics during an infectious disease outbreak. And from there, we extracted, from the articles, we extracted general information, study characteristics, occupational stressors, and organizational mitigation strategies. So that table that Dr. Yazdani provided at the beginning was an example of a summary table of the stressors that we've identified. But we also extracted a bunch of organizational strategies that was organized as much as possible based on the desired organizational elements that we identified through the key informant interviews. So some of the mitigation strategies were sorted into work culture, training and awareness, maintaining resiliency, detection of OSI and its risk factors, supports for mental health, and accommodations. But we also identified a few more elements as well through the review. So there were organizational strategies that we found related to data collection, communication, emergency preparedness, and infection prevention and control. So we extracted a bunch of organizational mitigation strategies from those research articles. And we also, from all the evidence that we collected, we also mapped out all the significant relationships that we've identified. And from doing this exercise, we found that there were 4 organizational interventions that have shown significant impacts, as indicated by those green boxes as organizational interventions. And we also found that there were several factors related to attitudes, feelings, and beliefs on the right column with those white boxes with the colored outlines. So these were factors that were significant predictors as well for favorable behaviors and behavioral intentions during an infectious disease outbreaks. So favorable behaviors and behavioral intentions being things like willingness to work in another community, willingness to wear PPE and comply with infection prevention and control protocols, seasonal vaccine acceptance, and pandemic vaccine acceptance as well. So that was a scoping review. And lastly, we conducted an interview study during the first wave of the pandemic that's still going now. Here we learned about paramedics and organizational leaders' experiences in the changes, stressors, and mitigation strategies during the first wave of the pandemic. And there were 5 reoccurring topics of discussion. But overall, we found that addressing OSI is not only about providing mental health specific interventions like mental health training, post-incident interventions, peer support, employee and family assistance programs, and access to mental health professionals. I mean, these specific mental health programs are all very important, but they're only one component to addressing OSI. And from the interviews, we saw that many organizations have implemented a lot of solution-focused strategies to support workers' mental health by demonstrating the organization's commitment to protecting workers' health and well-being. So they did things like ensuring that staff had adequate PPE, or providing lodging and accommodations for workers so that they can self-isolate. We discussed how being able to get to these root causes of the stress have been critical, because no amount of mental health specific interventions or counseling can fix the fact that there are PPE shortages, or that workers will need to go out of pocket to figure out how they're going to self-isolate and quarantine at home. So that's a very brief overview of the research that was conducted to inform this guideline. And we have presented the specific findings of each of these studies in our past 3 webinars, and they're on our YouTube channel if you'd like to revisit any of those. All right, so based on all the 4 studies that we've conducted, we have over hundreds and hundreds of pages of data related to the stressors, the context, and the mitigation strategies associated with paramedic work during regular operations and during infectious public health crises. And so we had to try and figure out how to boil all this data down to something that's digestible for everyone, but still be comprehensive of our findings and be relevant and pragmatic for paramedic service organizations. So in the end, we ended up with 10 organizational elements that would serve as the framework to encapsulate all the recommended practices and mitigation strategies that we had identified. Oh, and yes, so I should mention that the draft of the guideline has gone through a stakeholder review process. And so some of the reviewers included researchers, clinical psychologists, paramedics, organizational leaders, and worker representatives as well. All right, so here are the 10 elements that forms the basis of the guideline. And we tried to frame each one as a verb to keep it as action orientated as possible. And so I'll briefly go through each of these elements to get us orientated, and then I'll provide a mini tour of the guideline, if you will. So first is commit. There needs to be organizational commitment to cultivating a psychologically safe and healthy workplace, because we know from our interviews and environmental scan that the way organizations address and discuss OSI in day-to-day interactions can reduce negative stereotypes, facilitate conversation, normalize support-seeking behaviors, and build rapport and trust between workers and management. And this is critical, especially during an infectious public health crisis, because there's going to be increases in feelings of stress, anxiety, and concerns over personal safety and family safety. And so workers will want to know that the organization's committed to protecting their health and well-being. And so the pre-existing work culture will play a significant role in how workers feel about reporting for duty during a crisis. As a first step to cultivating a psychologically safe and healthy workplace is having an organizational policy or statement to help ensure that considerations of mental health is integrated into the decision-making process. So in the guide, we provide a template of what the statement could look like. And so what I have on the screen is an example that we provide. It's adopted from the Canadian Human Rights Commission. And this is just to help organizations get started if they don't have a policy already. And so a policy and a statement needs to be followed by tangible actions to demonstrate organizational commitment, right? And we do acknowledge that all the other elements in the guideline will impact work culture in some way. So under this particular element, we focused on providing guidance on a few specific areas like challenging stigma, mental health promotion, sustaining the dialogue surrounding mental health, and ensuring confidentiality. One more thing I do want to highlight in this section or element is this table that we created to provide organizations with ideas on how to demonstrate organizational commitment to protecting and supporting workers right at the onset of an infectious public health crisis, so that workers' basic needs are proactively addressed instead of them needing to bring up their concerns. So we provide tips for addressing concerns over personal safety, concerns over family safety, and the logistics surrounding quarantine and self-isolation. The second element is communicate, provide clear and consistent communication. And as discussed in our previous webinars, one of the key challenges of this pandemic was dealing with overwhelming amounts of information that were constantly changing. And many found it very stressful to be receiving several updates on the changing policies and protocols and procedures. And this led to paramedics feeling doubt and confusion about whether they were doing their jobs correctly. So under this element of the guide, we provide some communication strategies to try to reduce the sense of confusion and overwhelm, as well as some strategies to align workers with new and emerging protocols. We also provided a link to CDC's guidance document for crisis emergency risk communications during infectious disease outbreaks as an extra resource as well. All right, educate, provide mental health and infection prevention and control training. So that's another one of the 10 core organizational elements. And as we know, mental health training and awareness plays an important role in reducing stigma and creating a shared understanding of the general risks, signs and symptoms, and the healthy and unhealthy coping strategies. So that's pretty well accepted. But one of the key challenges for organizations is figuring out what training programs should they provide. Studies find that people need better training and not so much needing more training, right? So fortunately, through our environmental scan, we discovered that BC First Responders Mental Health Committee, this group developed a list of knowledge, skills, and abilities that are necessary for supporting mental health in the workplace for various stakeholders. So they had developed lists of knowledge, skills, and abilities for managers and supervisors, workers, and family members. And so they assessed the curricula of multiple mental health training programs, including Resilient Minds, R2MR, and Mental Health First Aid, against this list of knowledge, skills, and abilities that's needed to support mental health in the workplace. So this is another resource that we've linked in the guide, which can be referenced for developing and selecting a mental health training programs. And a lot of the principles from these training programs are applicable in crisis situations, right? However, we do believe that more can be done. And in the guide, we further talk about psychologically preparing workers on the stressors associated with pandemics and how these training programs can actually facilitate workers in developing their own personalized resilience plans. You might also be wondering, infection prevention and control training, what does that have to do with mental health? Well, we know that knowledge gaps in infection transmission and procedures for personal protection can increase anxieties. And so training on infection prevention and control protocols can help workers feel more confident and competent in safely carrying out their roles and responsibilities and reducing the feelings of concern and anxieties. So that's educate. The fourth element is relieve. Provide opportunities for recovery and maintaining resiliency. So this element really speaks to creating the organizational structure and allocating adequate resources to facilitate opportunities for paramedics to take breaks and tend to personal needs like using the washroom or eating a meal. And as we talked about in the last webinar, there were medics going on as long as 10 hours without being able to drink any water because they were not allowed to remove their face mask in the ambulance or hospitals. So, and these were paramedics that were doing longer transfers. So ensuring these opportunities are available are critical because over and over again, we've heard how the inherent aspects of paramedic work make it challenging to maintaining a healthy lifestyle. And so active intervention is needed to enable workers to take care of their health, especially during an infectious public health crisis. And without these opportunities or organizational support to apply some of these mental health training and resilience tips, all the mental health training, all the support, the health promotion, they can sometimes be perceived as just an action item for organizations to check off, rather than being perceived as true organizational commitment to support paramedics' mental health and well-being. So in this section of the guideline, we provide tips to increase the likelihood that paramedics will have some opportunities for recovery and maintaining resiliency. All right, another core organizational element is having the mechanisms in place to identify and recognize the common and diverse risk factors associated with OSI. And organizations can do this by creating a list of organizationally recognized, potentially psychologically traumatic events that would automatically initiate proactive support like a check-in or peer support. And this would help alleviate the need for workers to seek support on their own. So in the guide, we provide examples of what some potentially traumatic events might look like for organizations to build upon based on data specific to their organizations. So some additional data can be coming from common incidents that have led to workers' compensation claims, or some common incidents that the peer support teams are responding to. But a key here is to ensure that all workers are aware that exposure to any of these organizationally recognized events would initiate a check-in so that workers won't be surprised or take it personal when one does occur. It's also important to acknowledge that exposures to potentially psychologically traumatic events don't impact individuals in the same way. And this list is not all encompassing. Exposures to other non-traumatic or cumulative stressors may also lead to OSI. And during an infectious public health crisis that's lasted over 1.5 years now, there's numerous of these cumulative and chronic stressors that could lead to OSI. And so in the guide, we also list, we provide a list of these stressors as well. But OSI, as a result of these chronic and cumulative stress, are often undetected unless it's been self-reported or it's been detected through behavioral and performance changes, right? So this leads to our next element, monitor, detect early signs and symptoms of OSI. And so self-reporting and entering the mental health support system has always been a challenge for paramedics, the paramedic population. And so what's interesting is that in one of the studies from that national survey of public service personnel conducted by CIPSERT, they found that paramedics had high knowledge in mental health and low stigma. So having mental health knowledge and having low stigma, you would assume that paramedics would have greater intentions to seek support. But the study actually found that paramedics were among having one of the lowest intentions to seek help if it's needed compared to other public service personnel, including corrections officers, firefighters, police, RCMP, and such. So what does this mean? This means that there might be more to getting paramedics to seek support than just challenging stigma and providing mental health training. And so in the guide, we provide a table of tips for overcoming common barriers to self-reporting and seeking support. And so one thing to keep in mind is that all these barriers often work in combination. It's never really just one barrier that prevents someone from seeking support. So that's why it's really important to take this comprehensive and integrated approach. So some of the barriers that we listed were potential consequences to others, potential consequences to self, affordability, lack of contextual knowledge of paramedic services amongst the mental health professionals, negative past experiences, and unable to self-detect or self-accept an OSI. So similar to a monitor, there's also not a one-size-fits-all solution to support paramedics. Everyone copes differently to stress. And so providing various types of mental health support services is another core element. And key forms of supports identified through our interviews and environmental scans included things like downtime, support from colleagues, so that can be from partners, peer support, and supervisors, and also access to mental health professionals. So that can be through extended health plans, employee and family assistance programs, and in-house mental health professionals. And so in the guideline, we provide various types of supports along with the benefits of each one and their potential barriers and recommended practices for implementation. So I just provided the table to give you a sense of what it might look like, but feel free to peruse through once you get your hands on the guideline. And organizations may implement one or more of these mental health support services based on consultation with workers and worker representatives. Whoops. There is one more. Sorry, just pushed the wrong button. And I did want to mention one more thing that's important is that in addition to having these supports in place, the organization needs to inform the workers about the available mental health support services and the confidentiality of these services. And again, those barriers to support seeking that we talked about in that last slide, those may hamper the utilization of these services. So it's important that those are minimized as well. And of course, during an infectious public health crisis, if possible, these mental health support services should be accessible remotely as well. All right. So provide meaningful work accommodations. So organizations have the duty to accommodate to the point of undue hardship under the Canadian Human Rights Act. And so during infectious public health crises, some workers may not be able to provide frontline paramedic service, but they may still be able to offer support through other activities. So temporarily assigning workers to modified duties or providing work accommodations may help workers to remain at work and maintain service capacity. So from speaking with some of our industry partners, some accommodations might be things like decontaminating ambulances and equipment, being a safety officer to ensure that workers were properly donning and doffing PPE, or delivering PPE to various sites. In the guideline, we also provide the basic principles of the return to work process and identifying meaningful work accommodations. All right, second last point, evaluate, collect relevant data to inform program development, and continuous improvement. So the guideline provides several ideas and suggestions of initiatives for organizations, but each organization is unique and there is really no one-size-fits-all solution. So it's always good to get feedback from the workers as to what they actually want. And these can be done through interviews, focus groups, and worker surveys. On another note, the work organization may already have many of these programs in place, and it's going to be important for them to assess these programs to ensure that they're being implemented as intended. A common example are the employee and family assistance programs, where many organizations have them in place, but they're often underutilized because of long wait times, that it's only for short-term counseling and then you got to pay, or that the counselors have limited knowledge about paramedic services and do not understand the occupational specific stressors. So in the guide, we provide various metrics for needs assessment, process evaluation, and outcome evaluation. And we really encourage this data-driven decision-making process. Along with the guideline, we're also working on a reflection and audit tool for organizations to document what they've learned during the COVID-19 pandemic and how they could improve for future infectious public health crises. So this is just a little sneak peek of one page from that document. And the last element is anticipate, plan for future infectious public health crises. So research has found that most EMS agencies do not have broad formal plans for response to large-scale pandemic events. And the ones that did relied on mutual aid from agencies that might not be able to provide mutual aid during a crisis. So obviously having a robust plan, response plan developed prior to the infectious public health crises is important for containing the spread of infection and maintaining efficient and effective paramedic service. But it can also allow workers and leaders to be psychologically prepared and aligned and trained to work safely and effectively at the onset of the infectious public health crises, and be better prepared to manage the volatile, uncertain, complex, and ambiguous conditions. And in this section, we provide tips for emergency response planning and ensuring that there's budget included in the funds for supporting workers' basic needs and mental health needs, among other things. We also know that the response plan may need to be adjusted depending on the specific situation. And we provide tips to address some common challenges, including dealing with supply scarcities, staffing shortages, and altered standards of care and ethical decision-making. All right, so that's the 10 organizational elements, just a quick overall framework. This is the overall framework of the guidelines. So within each of these elements, we provide a description and its description of its importance and provide several action-oriented tips. So without a further ado, I'll take you on a stroll through of this document. I'll just stop sharing my screen and pull up the other document. Okay. Share screen. Oops. All right, so this document, it's 16 pages on double spread, but we do have one available that's on single spread as well if you're interested. And in the guide, let's see. In the guide, we first provide a little intro into addressing OSI and how to use the guideline. And then you'll also find the 10 organizational elements right at the start as well. And, you know, if you want to just go by these 10 organizational elements, that's great. That's all you need. But if you want more details then you can dive right into the document. So under each of these elements, we talk about why it's important, and then we provide tips and ideas on what organizations can do to support it. So those tips can be found in these yellow boxes, and you'll see them within each of the elements. And throughout the document, you'll also see things like quick notes that will provide some quick facts. So this one was one of the ones that I showed for identify. So this was the list of the potentially organizationally recognized potentially psychologically traumatic events. You'll also find some footnotes with links that you can click directly on to get to some extra readings and additional resources if you'd like. So yeah, in the presentation today, I've just provided an overview of the elements, but you'll find a lot more tips once you give it a read through. And from talking to some of our stakeholders, it takes about 30 minutes to get through. And lastly, one more feature I wanted to point out in this guideline was the key references. So we provide a list of key references that have been cited throughout the document. And we have used as many open source documents as possible so that you don't have to hit a paywall. And then we know that's frustrating. So a lot of these references are freely accessible as well. And we've hyperlinked everything so they can be quickly accessed. So that's a very quick tour of the guideline. And we'll talk about how you can get your hands on this later on. And you can take a look at it on your own. So I'll just flip back to our PowerPoint presentation. Now, just for time, like 2 minutes left. All right. So that's a quick tour. And lastly, so as a reminder, this is a guideline. It's not a standard or a regulation. So you don't have to implement everything to kind of like be compliant with everything in the guide, right? But striving to implement all of these elements will take you closer to an integrated and coordinated approach to optimally addressing OSI in the workplace. And many items within this guideline are actually in alignment with the Canadian Standards Association standards Z1011.1 that we're working on right now, the work disability management for paramedics. And it's also in alignment with the Z1003 1-18, the psychological health and safety in the paramedic service organizations. So following this guideline will take you a step closer to being compliant with those standards. Now, in terms of some of the feedback that we've gotten through the evaluation process, it's been very positive. Our stakeholders have shared that the guideline is very applicable and action-oriented for paramedic service organizations. And it does a good job pulling everything together and organizing it into one comprehensive and easy to read package. So they also shared that a lot of the material in the guideline was relevant for regular operations as well. And a common suggestion was to develop this tool, kind of like this checklist to go along with the guideline to help organizations assess where they're at in terms of addressing OSI. And so I've given you a sneak peek of it earlier. And so we're currently in the stages of finalizing that evaluation tool. All right, so that's the end of my prepared presentation. I'll turn it back over to Dr. Yazdani to talk a little bit more about how you can get your hands on this document, our next steps, and for some closing remarks.
Thank you, Bronson. So the guideline, which includes the comprehensive guideline that Bronson presented, a quick start guide, which is about a 1-2 page document providing an overview, as well as the evaluation toolkit or self-reflection toolkit. That will be available through our website. The guideline and the quick start guide will be available by Friday. Everyone that registered for the webinar will receive a copy. Bronson will send you an email with the link to how to download the guideline. The guideline is free access to Conestoga College's website, and that you will be able to share the link with your network. And also the audit and reflection toolkit will be available by August 30th. And again, that will be also through our website, and you will receive a copy of it as well. And Bronson will make sure that you get a copy via email. At this moment, I would like to thank our funding sources, Different Research Development Canada, for the projects completed prior to COVID-19, and the Social Science and Humanities Research Council of Canada on behalf of the College and Community Social Innovation Program, Applied Research Rapid Response to COVID-19 for funding the research and development of this guideline. I would like to also thank my colleagues, Bronson Du, who did an amazing job on this project, Drs. Young, Bigelow, Buscart, and Norizikia. Also our research assistants, Sarah Rizvani and Jenny Gruber, and our graphic designer, Hannah Grimmer, who are doing an amazing job supporting this research and development project. I would like to also acknowledge our research partners, County of Renfrew Paramedic Services, Peel Paramedics and the Union, Alberta Health Services, Paramedic Association of Canada, Public Services, Health and Safety Associations in Ontario, and most importantly, participants who volunteered for this research studies. So that's the end of the presentation. Again, I really appreciated everyone's support for this important work. Now we have, I think, a couple of minutes for some QAs. So I'll hand it over to Corey.
Okay, great. Thank you, Bronson and Dr. Yazdani, for such a great presentation. And thank you to those of you who submitted questions for the speakers. We do just have about 3 minutes left here. So we do have one question I would like to bring up. Someone was asking, oh, sorry. Okay, so someone was asking, are there any plans to disseminate this guideline to paramedic service organizations at the moment?
Okay, I can answer that. Yes, so the guideline, again, as I said, will be available through our website, but we also have reached out to our partners and asked them if they will be willing to share the guideline with their network. So we are happy to partner with them in disseminating the guideline, and some agreed to help us in distributing the guideline. We also hoping to print out some of this guideline, the guideline on a limited quantity and send out to our partners to kind of provide a hard copy for those that might be interested as well. We also are hoping to be able to work with a CSA group to see if we can actually get them to make this guideline available through CSA's community of interest as well. So definitely it will be kind of a lot of avenues to disseminate the guideline.
Okay, perfect. Thank you for that answer. And just with the last minute, just as we wrap up, I would like to bring your attention to our upcoming webinar schedule. So you can visit our website or social media channels to find the schedule and the working registration links, and we hope to see you at our future webinars. If you do happen to miss a webinar or you can't make it to one of them, we will have all of our past recordings on our YouTube channel. So you can find that at CISWP, and we will be uploading our full webinar series from our work from home series as well as the paramedic series. So just want to thank you all again for taking the time to join us today. We hope to see you at our next webinar, as we will be wrapping up with the last webinar of this paramedic series. So I hope you all have a great rest of your day, and thank you again.